disease is a very challenging type of condition to work with, and it takes a lot of postgraduate education to attempt to manage these kind of patients. A gluten-free diet is probably most important for those patients who have an autoimmune condition, whether it's Hashimoto's hypothyroid or any other autoimmune condition that you might have, where a condition where the body's attacking itself. So it's very important there. But it's also important in patients who, let's say, have headaches. Gluten can also be a trigger for migraine headaches. Does that mean that every person needs to be off gluten? No. Well, we test for that to find out what patients are very sensitive to gluten and which ones are not. The treatments that we use in the office are very safe. It doesn't mean a patient might not, anyone can react to anything. So we give 99 patients the same thing, no reaction. Anyone can be sensitive to anything. I had a patient just the other day who was sensitive to oregano as a spice. We can be sensitive to anything, but it's still safe. They realize they have a sensitivity, they felt a little upset about it, we take it out. Alternative therapy is therapy that's different than, let's say, the norm. Therapy, many times we think of physical therapy. Physical therapy are things like machines or exercises that patients utilize to heal. Alternative therapy are therapies other than that. Things like nutritional counseling, things like medical foods, things like brain-based therapies. A lot of times we'll work with patients to try and get their brain stronger, to balance out left and right brain. And those are just very specific therapies that we utilize, very different than the typical therapy. When we work with metabolic patients, we absolutely give nutritional advice. We will do things like have patients write down everything they eat for a week. We will analyze that thoroughly and help put them on a proper diet. While we're doing that, we're working with them individually to find out what nutrients they may need, what medical foods they might need, and we learn those things through testing. The most difficult patients really are like a puzzle. We have to bring in a lot of different pieces in order to really analyze what's going on and how best to manage their condition. So it's very satisfying once we figure all that out and we see patients really make great strides in their health.